High cholesterol is a major controllable risk factor for heart disease and stroke, two leading causes of death worldwide. In the United States alone, about 93 million adults have cholesterol levels above what's considered healthy. The concern is that high cholesterol often has no clear or immediate symptoms. Many people have elevated levels without realizing it. That's why knowing certain warning signs is so important. Spotting possible symptoms early gives you a chance to adjust your lifestyle and seek medical care before serious complications develop. Here are 10 common signs and symptoms that may suggest your blood cholesterol is too high. I'll explain what each one means, how it links to cholesterol, and when to see a healthcare professional. The goal is to keep you informed so you can take proactive steps for your heart and overall health. Before we continue, let me know in the comments how old you are and where you're watching from. Leave any questions below. If this is helping you, consider joining our channel membership by clicking the join button for exclusive content and tips. Don't forget to subscribe and turn on notifications so you never miss a video. Let's jump in with the 10 most common indicators. First, fatty skin deposits. You might spot small, yellowish, raised lesions on your eyelids, elbows, knees, or buttocks. These are fatty buildups called xanthomas. They form when excess cholesterol collects under the skin faster than your body can remove it. Their presence can strongly suggest your cholesterol levels are significantly high and need medical attention. Second, high blood pressure. There's a strong link between high cholesterol and rising blood pressure. When excess LDL cholesterol circulates, it can collect along artery walls as plaque. This condition, called atherosclerosis, narrows your arteries and reduces smooth blood flow. As vessels narrow, your heart must work harder, leading to increased blood pressure over time. Third, chest pain. If plaque ruptures in an artery supplying the heart, it can block blood flow and cause a heart attack. Chest discomfort, called angina, can feel like pressure, tightness, fullness, or pain in the center of your chest. It may spread to your jaw, left arm, or upper back. High cholesterol raises the risk of this plaque and clot formation. Any recurring or unexplained chest pain needs a professional evaluation. Fourth, rapid heartbeat. High cholesterol adds strain to your cardiovascular system. When arteries around the heart narrow, your heart may beat faster or harder to maintain circulation. You might feel palpitations or a racing sensation. This irregular rhythm, or arrhythmia, can sometimes be triggered by stress or caffeine, but repeated episodes may signal an underlying circulatory issue. A resting heart rate consistently above 100 beats per minute should be discussed with a doctor. Fifth, erectile dysfunction. For men, this can be an early warning. Narrowed arteries limit blood flow throughout the body, including to reproductive organs. Erectile dysfunction happens when there isn't enough blood flow to maintain an erection. A common vascular cause is atherosclerosis from high cholesterol. When smaller arteries become partially blocked, blood supply drops. Persistent ED can sometimes be an early indicator of cardiovascular disease. Sixth, numbness and tingling. A tingling or prickling in your hands, feet, or limbs is known as paresthesia. This can happen when plaque buildup restricts circulation to peripheral nerves. Reduced blood flow can interfere with nerve function, leading to unusual sensations. These symptoms often appear at night or after staying in one position too long. It may signal peripheral artery disease, a condition linked to high cholesterol. Seventh, vision problems. Sudden blurred vision, double vision, or partial vision loss are often related to eye conditions, but sometimes they connect to cholesterol. Plaque can build up in arteries supplying the retina and optic nerve. When blood flow is compromised, delicate eye structures can be damaged. Vision changes from cholesterol typically affect both eyes. An eye specialist can determine if cholesterol or another condition is responsible. Eighth, dizziness. Occasional lightheadedness can be harmless, but frequent episodes may link to restricted blood flow to the brain. Conditions like vertigo or migraines can also cause dizziness. However, when neurological symptoms occur alongside cardiovascular risk factors, cholesterol should be evaluated. Narrowed arteries reduce oxygen to brain tissue, and brief spells of imbalance may reflect reduced circulation. Ninth, fatigue. Ongoing tiredness. Despite adequate rest, may mean your body isn't getting enough oxygen. When plaque limits circulation, less oxygen reaches muscles and organs. You may feel weak, sluggish, or easily exhausted even during mild activity. While fatigue has many causes, poor circulation from high cholesterol is a possible contributor. 10th, memory changes. Some studies suggest high LDL cholesterol may impair blood flow to the brain, affecting cognitive function. When arteries narrow, oxygen delivery to memory centers decreases. High cholesterol in midlife has been linked to a greater risk of dementia and Alzheimer's disease later on. Brain fog, difficulty focusing, confusion, or forgetfulness could sometimes reflect these vascular changes. While memory decline has many causes, unexplained cognitive shifts should prompt a discussion about cardiovascular health. In summary, these are 10 signs that may suggest your cholesterol levels are too high. Remember, a simple blood test is the only reliable way to confirm your status. For most healthy adults, testing is recommended every 4 to 6 years. If you notice several of these symptoms, schedule an appointment to evaluate your risk. Early detection lets you manage cholesterol effectively through medication, dietary improvements, and regular physical activity. Thank you for watching. Take care of your heart. If you have any questions, feel free to ask.